All right. Welcome to our first provider spotlight with Valleywise Health. We're excited. I'm Haley Wentberg. I'm our executive director at the Arizona Peer and Family Career Academy. We are so excited to have you join us virtually. Some Zoom basics. We do ask that everybody stay on mute unless you are hoping to speak. If you'd like to ask a question, please feel free to raise your hand. That way we can call on you. I'd love it if everyone could take a moment to introduce themselves in the chat, share your name, your title, what organization, if you are connected with an organization, as well as what is your favorite place to visit in Arizona. Mine is any of our beautiful Arizona lakes. Everyone thinks that, we're the desert, so we don't have water, but we have some gorgeous lakes throughout our state that I appreciate. With that, I'm going to share a little bit about who we are at PFCA for those that maybe aren't as familiar with us. Our mission is to inspire recovery and wellness through professional development and continuing education in order to equip emerging leaders and strengthen the peer and family workforce. We have lots of current courses available. Some on navigating the forensic system, understanding the opioid use crisis, understanding our DDD system, motivational interviewing, trauma-informed care, and many more. We're super excited to be joined by Valley Leadership, who will be sharing about some of their programming, their organization, and some opportunities for our peer and family supports in Arizona. So with that, I pass it on to you guys, Valley Leadership.
Great. Hello, everybody. My name is Jose Luis. I am the manager of the Integrated Behavioral Health Program. And just really quick, are we the entire hour today, or are there other folks? I don't want to hog the time if that's...
You are the entire time.
I am. Okay, I can go with that. So I'm going to quickly introduce myself, and then I'll let the other folks from Valleywise Health introduce themselves too, and then we'll kind of jump into our presentation about the Integrated Behavioral Health Program and our MAT services. So I'll be directing traffic. So I'll, ask Barry and Lawrence to chime in, and Vicky also, obviously. But yet again, so I'm Jose Luis. I'm the manager of the Integrated Behavioral Health Program. I've been at Valleywise for it'll be 6 years this July, which has gone by very fast. And we've had a lot of growth during that time. So I will let Vicky talk next.
Good afternoon. I'm Vicki Staples. I'm the Director of Outpatient Behavioral Health Services at Valleywise Health. And I don't know, Jose Luis, if you're going to give kind of an overview of what Valleywise Health is and kind of how our system is set up.
I just had planned for, and sorry, I couldn't unmute myself. I just had the presentation is mostly about integrated, so probably be helpful to talk about the entire system.
Okay, well, I'll give a really quick overview after the rest of our team does the introductions, and then I'll give a quick overview of Valleywise, and then Jose Luis can talk more about integrated behavioral health, and Matt and all the exciting opportunities we want to talk with you today. So I'll turn it over to Barry.
Good morning, everyone. My name is Barry Weeder, and I am the peer specialist for IBH at Valleywise Healthcare. I've only been with the company a few short months, but I am strategically directly involved with the SAMHSA grant for medically assisted treatment. And is Lawrence on, or? I don't think Lawrence is here yet. So
I see his name. I don't know if he's muted, but perhaps we'll give him a second to chat.
Lawrence, if you're there, Lawrence, you want to introduce yourself?
Well,
okay. I can.
Oh, there you go.
There he is.
I can hear you guys. Can you hear me?
Yes.
Yeah.
Oh goodness, I apologize. I'm having the worst time trying to get. Okay, where are we at? How I'm late. I apologize. I can
just introductions for now, Lawrence. So if you could just give a quick introduction of yourself.
Lawrence Thomas, Valleywise Health, licensed clinician, peer support specialist, member of the Peer and Family Career Academy Board.
Cool. Well, Vicky's going to give a quick overview of kind of Valleywise and what we do, and then we'll kind of jump into our presentation here.
Okay. We were talking before everybody joined. Actually, Valleywise has had several names over the years. We've been Valleywise Health. Most recently, we were rebranded in 2019. But prior to that, we were Maricopa Integrated Health Systems. We were Maricopa Hospital. We've been a variety of names. But I'm going to start with a quiz for folks to see how many, if anybody knows, when was the original hospital built by Valleywise? So when did Valleywise start? Anyone have any idea when that was?
This is George. I'd like to suggest it was the Spanish flu.
Yeah, you're pretty close. We were back in 1883. So not quite the Spanish flu, but we were definitely back. And that was when our first hospital was built. And we go back to the tuberculosis timeframes, from my understanding. There's probably even more history there. But that's what I wanted to just share. Valleywise has a long-standing history of being the public safety net system for Maricopa County. So we have a strong tradition and a strong value around serving individuals and communities that typically are underserved. And so we started way back in 1883. And so our system, our hospital system, when you think about it, a lot of people and many people were born in our hospital on 24th Street in Roosevelt, right? 2601 East Roosevelt. Then we have been that public safety net for over 140 years. So we have a long history. So if people are worried about our business is going to go away or we're not going to be around in a couple of years, believe me, that is not a concern. We are here to stay and have been here for a long time. We are a huge hospital-based system. We have our medical hospital. We have 3 behavioral health hospitals in Tucson. I was thinking about you driving to Tucson today. In Phoenix, Maryville, and Mesa. We have a burn center that's internationally known. We have a level 1 trauma ER. We have pediatric trauma. We have our McDowell Health Center that really focus on individuals in primary care and behavioral health for individuals with HIV and AIDS. We have 13 federally qualified health centers, and Jose Luis is going to talk about all the exciting work that's going there. Lawrence and Barry also will talk about that. But we're a big hospital system. So we have on outpatient behavioral health, and that's where I work. We really divide that into 2 areas. We have our specialty behavioral health clinics, which some people call behavioral health homes, or sometimes they're referred to in kind of back in the day, they were called the SMI clinics, or those clinics that really focus on serving individuals with high needs. And so in primary care, when you need additional support, you go to a specialist. And we feel that's the same way with behavioral health. If you have a need for a higher level of care that can be provided in an integrated setting, you go to one of our specialty clinics. And then we have all of our integrated behavioral health services. In our specialty clinics, we focus on first episode centers, so helping young folks who are experiencing psychosis for the first time. We have an ACT team, and then we have our Mesa Behavioral Health Specialty team. So we're a large hospital system, but what also is really exciting is we're a huge teaching hospital. Our CEO says that teaching is in our soul. And so we have over 11 different times of residency. So we're training future doctors, we're training future residents. We have LMS students who are working to become independently licensed. We have social work. We have doctorate of behavioral health students. We have a lot of opportunities for students who what we like to say want to learn with us and grow with us and stay with us. So there's a lot of opportunities there. So now I'm going to hand it off unless anybody has any questions about the Valleywise Health Hospital System or our outpatient services. Otherwise, I'm going to turn it over to Jose Luis.
Well, I better not have any questions, right? I should know the answers. So, oh, I can't share. Do I need to um, send you my PowerPoint? I apologize. I didn't realize that. It says that's
Nope.
disabled.
I will give you sharing
Okay.
privileges right now.
Perfect. Ah, there you go. So let's see here. So hopefully you can see my screen. Um, First, I want to apologize. I didn't write anybody's credentials after their names. I didn't get the chance to add that earlier today. So for those on the call from Valleywise, I want to quickly put out an apology there for that. So I will share this presentation with you so you can share with the other members that will probably be watching on YouTube, but I'll try to go quickly over like our IBH program, and then hopefully not hopefully, we will get time to talk about our MAP program more in depth, and then really to talk about our peer program that we're wanting to discuss a lot more today, because we will be hiring more folks for our MAP program. And we require peers for that program to be successful. So we're looking at having more peers within our FQHCs. So that's one of our biggest drivers today in our presentation. So there we go. So we have a lot of different integrated behavioral health programs within our like overarching kind of stuff. We have counseling services available. We have adult and child and adolescent psychiatry programs. And obviously today we're talking about medication assisted services. I don't have listed our TIP programs and other programs that we work with, but this is the bulk of what we do. So with our MAP program that we're starting here, one of our biggest selling points is that it's within our FQHC clinics that you'll see down here at the bottom. We're not at all the clinics at this point. We're hoping to add them here in the future. Right now, in this presentation where it says future, that means we'll be in those clinics providing integrated behavioral health, not necessarily the MAP program. So for right now, and I don't want to jump the gun because that's another part of our presentation, is where we're currently at. So we're all at the FQHC clinics, like Vicky mentioned earlier, the amount that we have. So one of our selling points with the MAP program is that we are in primary care, so it's not its own separate clinic. So folks who are getting their medical services through us at Valleywise can get their MAT services, their psychiatry services, their counseling services all within our FQHC clinic. So folks don't have to deal with the stigma of going to a separate clinic to receive their services. Again, I kind of already talked about this, but our major focus with the integrated behavioral health program is providing whole health care. So not only do we work with folks on their mental health, but we also work with them on their physical health with the partnership that we have with our clinic. So we try to address social determinants of health, try to reducing those barriers for patients to get the care that they need. The one caveat that might be sometimes a bit difficult is we only serve those who go to our FQHC clinics. So if folks want to get services through us, we would want them to get their primary care services at Valleywise. And the reason behind that is because we want to help people get all of their services in one spot, because I guess we're like a one-stop shop kind of deal. So we want to make sure that folks are connected with primary care, behavioral health. If there's any other like specialties that they need, like podiatry, things like that, we can get them connected within our Valleywise system. Is there anything that the Valleywise team would like to add, or any questions that we have? And people can stop me if there's anything they want to add to the discussion or the conversation.
Jose Luis, you might want to explain what an FQHC is, because
Oh
some
yeah,
folks might not be familiar with that term
that's
or familiar
fair.
with the
Yeah.
term MAP.
Yeah. So for the FQHC, that's a federally qualified health center. So really, which that means is we provide services as a safety net. So we provide services to folks on a sliding fee scale and all the insurances that we are contracted with. So for our patient population, it's really nice to have these sliding fee scales because, and I'll talk about that later on, is depending on where they are financially and where they meet our sliding fee scale, they can receive services at the minimal cost of $20 for appointment. And that's the same thing with integrated behavioral health services. So if someone wants to see a psychiatrist in their category 1, their appointment would be $20, which I think is great. Obviously, that just depends on where people are economically, but $20 for an appointment for some folks, that's less than their copay. At least that's what it has been for me in the past. So, and for the MAP program, and I apologize for not kind of delving into that earlier, that's our medication assisted treatment program. We're going to talk a lot more about what type of medication assisted treatment we'll be providing at Valleywise, but that's the acronyms that I've been using. And we'll use IBH a lot just because saying integrated behavioral health is a bit of a tongue twister. Cool. Is there anything else? Any questions from the folks online? So I've already talked about this a bit more, but earlier. But the one thing to kind of mention that I'd like to add is we do a lot of screenings with patients. So it's not just depression. We do a lot of different screenings, and one of the biggest ones that we're pushing a lot is the social determinants of health, or SDOH. We want to make sure that we help people get the different types of supports that they need. Because if you're struggling with home insecurity or food insecurity, it's going to impact your mental health or physical health directly, right? So we want to make sure that we screen for different things outside of just mental health related concerns. So we do that's one of the additional focuses outside of providing counseling and consultation. And then the other thing to add is that if we're not the most appropriate service for the patients that we serve, we will provide referral sources and connect them to the services that they might need outside of Valleywise Health. Just more about our wonderful services. Obviously the last piece is our MAP program, which again, we talked about earlier, is we're trying to have folks come into our clinics to receive the MAP services so they can also get that support with their physical health, seeing their primary care doctor, and then having our integrated behavioral health services involved, where we have Barry, who is a key person in our program to help folks get connected or reconnected, because they might start services and they might stop, right? So we want to make sure that folks get all of the support that there's needed. More of our program. Oh, that's a duplicate. I didn't realize that. Apologize. So for Barry, if you would like to kind of talk a little bit about your position and what you're doing with our MAP program, and then I'll go into a little bit more about the cost for services and things like that.
Yeah. Good morning. So basically, I was hired. Actually, I was hired as a peer support specialist, and I thought I was coming into this as a peer support specialist, but I'm grinning a little bit because I'm doing a lot more, and I love it actually. I love the fact that I'm able to provide some of the additional things that a lot of the team just hasn't really had a lot of time for. So I'm able to jump in my position and do things like work on marketing materials for our doctor and patient groups. We've got 2 flyers that we're currently in process with our creative team. that will address the specifics of the program for the doctors, and then more of a not so specific, that not the general terms and everything that the doctors would rely on, but for the patients, just more of an attention grabber, something that kind of, that they could see or receive and say, yeah, this is something that I need for my personal recovery. So medication assisted treatment for any of the new peer specialists, and it was kind of new to me as well. These are people that are going to your typical methadone clinics that have to go there every day. And almost it's like you don't really have much of a life when you're committed to that. With our program, we are not a methadone clinic, but rather a a clinic that uses alternatives like Suboxone and naltrexone and some of those alternative coping type, craving type drugs that are provided by a medical provider. And this way, you actually have a future. You have an opportunity where you can lead your daily life, yet reduce the cravings over time. And eventually, everyone's goal and my personal goal as a peer specialist in my recovery was to get off of what I was on. And I did. So I think that's what everybody's looking for, not to have to go to a methadone clinic every day for the rest of your life. So that's our MAT services. And I am basically the first person that was hired as far as the IBH MAT program. It's a government grant for 5 year and beyond, we hope. But we do have a number of those positions that are needing to be filled in those upcoming months and years ahead of us. Any questions for any of that? Or things that I might have missed, Jose Luis
Yeah,
or Lawrence?
I'll add a little bit to it. I think that, we're talking a lot about our MAP program, but I think the other part that is really important to us is just finding peers that are willing and wanting to work with this population. Because I know that we are at Valleywise. It's a big system. I think it's can be very intimidating. Folks think that they can't work for us based on like different history that they might have had in the past. And, we'll work through some of that. We do require that folks have to have a fingerprint clearance card. So for some reason, if they can't, that might be the biggest barrier, or that might be the only barrier that will be for employment. But one of the things, is we really want to increase our presence with having peers. And I know that, as there's a difficulty in work shortages right now, finding folks and getting folks to apply and do those different things. Really, what we were hoping today is to talk a lot about our MAP program, but also to highlight the need that we're having and wanting to have more peers in our system. So like Barry said, he is one of the first. I don't know if Lawrence would want to say he's the first, but I'll let him decide if he wants to take credit for that or not. But I will kind of talk about maybe your experience, Lawrence, in regards to working with Valleywise and, unceremoniously right now being technically kind of our first peer.
Right. Thanks, Jose Luis. Yeah, so I'm Lawrence again. I want to apologize. My audio is working, my video, I don't know what's going on. I'm not a technophile. So my apologies there. So I've been at Valleywise since September 2018, back when it was still called Maricopa Integrated Health Systems. I was hired as a specialist, a behavioral health specialist, which is the associate level license position within integrated behavioral health. And then within the first 6 months of being hired in that capacity, I was asked to help open the SMI clinic, what we call the specialty clinic. Vicki does not like the term SMI clinic, our specialty clinic for folks living with the SMI designation. And so I was the peer support on that team for a year until they were fully launched. And then I resumed my duties back as a specialist. And then within the past 18 months, I received my independent license. So now I'm an independently licensed clinician and still a peer support. I'll always be a peer support till the day I die. So technically, yes, Barry, I was, he was the first MAT peer support. I was the first IBH peer support. But even before that, we had peers at the First Episode Center, peers that are on our ACT team, and that are just doing an awesome job over there, doing a really great job. So now, and we've also had peers in our inpatient setting as part of a collaboration through, I think Haley remembers this, as part of our collaboration with Recovery Innovations, where Wah, when he was at Recovery Innovations, collaborated with Laura Smith at that time, who was the inpatient director, Vicky's counterpart on the inpatient side. And we paired peers actually on the inpatient units at Desert Vista and the Annex to work hand in hand with folks as they transitioned into the inpatient system of care and then back into the community. And then we stayed with them for 90 days after they went back to the community after inpatient care. So that was actually the first peer support presence at Valleywise ever. So anyway, that being said, I can't remember exactly what Jose Luis asked me to talk about, me, peer support, Matt, or what. So you know me, I can talk in circles.
No, I appreciate all of that insight. Really, you did all that I was hoping for. So really, I wanted you to talk about your experiences as being, you know, a peer or within IBH. And I know that there's the other programs within outpatient behavioral health, but really, you know, for integrated behavioral health, it's not necessarily a requirement like other specialty services, but we really see the value in having peers as part of our program to really help those folks struggling with their recovery or with any type of support that they might need within integrated. So
I would say that one aspect, Jose Luis and guys, that my peer support skills became exceptionally handy was when I was asked to participate in the targeted investment program, justice program, where we were working with folks who were coming out of incarcerated settings and re-engaging the community for the first time, in some cases a couple months, and in some cases 25, 30 years. They had been incarcerated, and we were basically the linchpin that helped connect them to mental health services, behavioral health services, basic reentry and housing services. And that is a program that started around the time I was hired in September 8, 2018, and is still going strong. In fact, has grown stronger. Cheers is one of the peer-run organizations that's involved in that. Hope Inc. and Hope Lives are also two peer runs that we work integrally with as part of the TIP Justice program that was a pleasant surprise for me to have the opportunity to get involved in when I got hired, thinking I was coming to work as a specialist who's going to work toward getting my independent license. And then before you know it, I'm working in two different peer support domains, both with the specialty clinic and with the TIP Justice program. So Valleywise is doing a whole lot when you get down to the real granular features, a whole lot with peer support right now. And we're looking to do a lot more. I'm done.
Oh, you're fine. I was processing.
You gotta stop me sometimes.
No, I think it's really helpful. And I think that, you know, again, you know, our primary focus, our two focuses was to talk about our MAP program and to really talk up our peer program, because I think folks don't really know about us. They might see the posting online and they go like, oh, that's awesome, but they don't really know about Valleywise and integrated behavioral health. And so I think, you know, thank you, Lawrence and Barry, to really talk about your experience, because, you know, as the manager of the integrated behavioral health program, I understand the program inside and out, but as a peer, I would be disingenuous to pretend like I know how it is to be a peer and work for Valleywise. So that's why for me, it's really important that you guys talk about your experience. So I really appreciate you guys sharing that with us. So to kind of circle back on talking about the cost of our services, you know, being that we are part of the federally qualified health centers and the FQHCs, I mentioned earlier about our sliding fee scale. So if you are working with folks that for some reason can't get on insurance for different reasons, the one nice thing is we do have our sliding fee scale, which is available to everybody, from, you know, babies to, you know, geriatric population. And so it really, and I don't have the, you know, what folks have to make to meet these different categories, but for example, for our MAT patients, if this was something that they were interested, they would receive their MAT services for $20 an appointment. We use session just because this is more focused on integrated behavioral health services, and we go by sessions, appointments, what have you. But for seeing their primary care, it would be $20. So depending on the person and what level of support they're needing, if they don't qualify for Medicaid, Medicare, or have their own private insurance, we can provide them with support within Valleywise at that cost, which I think is great for those folks that might not qualify for one of those public programs. So just to kind of talk briefly about our workflow. So this is for integrated behavioral health. If it were to be kind of how it typically works, all our services are referred by the primary care doctor, but for our MAT services, we are making a bit of an exception. Folks can contact us to receive MAT services, and we'll work with them to get connected with primary care. And then we will deal with all of our internal referral processes. But if there is a time where a patient is referred to integrated behavioral health, it would, through the primary care doctor, it would go through our typical workflow, which is they're referred, we get the referral, and then we do a consultation to see what type of services they're interested in. MAT is not listed as part of this workflow example, but obviously if there is a part where someone says that they want support in their recovery and want MAT services, we would connect them to the right folks and get them at one of our clinics to get that service. So really, this is our current workflow. It is all kind of run through primary care. We want folks to get, you know, both their physical and mental health concerns addressed. As you know, we want one thing will impact the other, right? If I'm good mentally and I'm not doing so great physically, it could impact my mental health if I go back to having, you know, problems with my diabetes or something like that. So we really want to help folks get treated on both ends so we don't have any of that lag or issues coming back to, I guess, haunt them in the future. So this is just like a quick overview, and I know that Barry and Lawrence can talk a lot more about it, but these are the current clinics that we're at internally. We're hoping to expand to all of them. We do have our medical providers. We do have our peer support. One thing to mention that this is for adults only. We don't really talk about that usually on the front end, but we don't provide support to minors, but we will connect minors to the correct service provider if it comes to that point. For our purposes of the grant that Barry mentioned earlier are that we have through SAMHSA, which I don't know the acronym off the top of my head. So if Barry or Lawrence know the actual acronym, you know, say it now or whenever you get a chance. Our focus is folks struggling with opioid use disorders, but we do work with folks struggling with alcohol or tobacco use. So it's not just opioid, but that is the target population in which our grant is wanting us to focus the most on. And that's where our efforts are being placed today and in the future. So we do have one internal number. The referral 251 doesn't necessarily apply to the community, but if there are patients or folks that you know that would like to be connected to our MAT services, they can call our centralized phone number at 602-344-1900. And that team will help get those folks scheduled to getting services, or depending on what the level of support those folks are needing. Barry will always be involved, but there will be points where Barry might be the point person for that person to get scheduled and connected. And Barry and Lawrence, and either of you look up what SAMHSA stood for?
Oh,
I haven't looked it up,
I
but
didn't look it up, but I think
I could start it. Yeah,
Substance abuse,
substance abuse, mental health services
administration.
administration.
I probably should know that. They've given us quite a bit of money.
They've given us lots of money.
But, you know, again, like Vicky said earlier, you know, there's a lot of acronyms out there, and a lot of us know what the acronym is about, but maybe not necessarily know what it stands for. So that is basically our overview about MAT. I see that there's something in the chat. I don't know if it's a question, but I will take a peek at it. Oh, someone wrote it in. Substance Abuse Mental Health Services Administration. Thank you so much. Haley, I think you wrote it, right? Okay, awesome. So I really appreciate you telling us that. We probably should have known that.
Well, I kind of knew it. I just was waiting for someone else to say it.
Yes,
And
I hear that.
I couldn't remember the second S. I'm not gonna lie. I couldn't.
Look, you know what? That's how informal and how helpful we try to be here. I do see George's hand up, so unless he's trying to give me a high five for the amazing presentation I just gave, I'm assuming he has a question.
Oh, certainly all four of you have done an amazing job. I wondered about the cost. If I was had access, so therefore Medicaid, the cost would still be based on my income for the copays. In other words, are the copays ever prohibitive for treatment? And secondly, would the grant be so that people can have their copays waived or paid by the feds? Thank you.
Covered. Yeah. So if you have Medicaid or access, everything's fully covered. So you don't have to worry about co-pays and stuff like that. For the category 1 through 4 and 5, technically, those are they're not covered by Medicaid because that's a sliding fee scale. I know that there are funds within our grant to cover that. I would have to do probably a little bit more digging in regards to that, but I know if that's a barrier for somebody to receive MAT treatment, we would just want to know on the front end so we can get the grant to pay for it, or see what other options we have internally to cover those costs. But for those who are Medicaid, that's fully covered. Medicare, it's a bit more complicated for me. I don't quite know fully what the copay is. I think it just depends the coverage they have. But if it is something that we do know, we could try to look it up and help them. I know that it just depends their insurance. Even if they have private insurance, their copay kind of varies. And it would be the same type of appointment if they were seeing primary care. So if their copay was $20, my assumption would be that it's $20 or I don't know if copays are even that low nowadays, but 35, whatever their copay might be. But I think if there's a barrier in that, I think we could definitely meet as a team and try to figure out what we can do to support those folks.
Thank you very much.
Awesome. Yeah, no worries. I know we're kind of close to the 15-minute mark. Haley, is there any questions that you might think that folks that might be watching online might have?
Yeah, if they were interested in joining your team, where should they go?
Yeah, so I think you have it posted. I've seen an email that you have. So the link at Valleywise Health is definitely the place to go. If you want to message Haley and she can email me, she has my information. We can give you guys that information. But ultimately, Valleywise has the expectation that folks have to apply through our system. There's times where I get people's resumes and they're awesome and I like them, but they have to apply. And for some reason, that's been a barrier occasionally. Folks don't apply. And so we can't really move much forward past that. So yeah, if they apply, if they let you know, Haley, that way we can have an eye out for their resume or their application. We can talk to our HR team that does that piece, and I can ask them to keep an eye out.
Perfect. Thank you. I want to thank you, Valleywise and your amazing team for presenting. Lawrence, it's great to see you. And Barry, I'm so excited that you joined the Valleywise team as a peer support. Excited to see what your future holds as a peer support within Valleywise system. So thank you so much. Some upcoming courses and events that we have here at PFCA. We have another lunch and learn on why tobacco kills, talking about the importance that we have some conversations about tobacco for health and wellness of our members. We have 2 new courses that we're launching this month, one on ethics and boundaries, which as a reminder is a required learning that we all have to do as peer support specialists and family support specialists, at least 1 hour every year on ethics and boundaries. We also will have another course on motivational interviewing, which has been highly requested for quite some time. So I'm excited that we will be launching that course. And I definitely hope I will see you all there. Thank you so much for joining this and watching this online later. It is much appreciated. And I definitely hope you will add Valleywise to your list of resources. And if you're seeking employment, that you'll consider joining their awesome team. Thank you so much.
Thanks so much.